Hello, welcome to the Health In Show, an affiliate program of Homeopathy World Community. You've come to the right place to tune in and participate with your comments and questions. Love is the greatest healer of all, but sometimes, in order to change our emotions, we must take action in other spheres of our lives. We speak with experts in alternative and complementary health fields and hope you will benefit in some small or great way. Remember, you are wherever your thoughts are. Make sure your thoughts are where you want to be. Welcome, everyone. It's November 4th, 2013, and you are here with us on the Health In Show, an affiliate program of Homeopathy World Community. We'll be speaking with a person that I adore, admire, and think is a bright light in homeopathy around the world, healthcare, and innovation. That is Karen Allen from California, and she has made every effort to get up early and be with us. So I hope you'll all be applauding and smiling and chatting. You can call into 919-518-9773 on your phone or via Skype at Computers 2K Voice. And we are here. I would like to give her an introduction. Also, she has provided for all of the listeners and viewers a PDF file to go along and follow her PowerPoint. If you wish to take the time to do that, go to homeopathyworldcommunity.com. You will see the banner on the front page, which will take you to the announcement of and the background for Karen. And with that, you'll see it says in the list, urinary frequency document PDF. Just click that and it should open right away. If you're out there and you know this is an important topic, run out right now to Twitter, LinkedIn, Facebook, or send an email to your friend and tell them to come right on in, ask their questions, or just listen and comment on the chat. Also, on Nissan Communications, I want to thank Amnon for all of the hard work he does to produce these shows. There are new ways to listen. You can listen right on nissancommunications.com on Bamboozer, a brand new one called Vaughn, Daily Motion, Justin. I like to listen on Stitcher, and there is an RSS feed, and many people have already told me that can they get an archive? Yes, you can. So there's so many different ways that you can link up with us, and we welcome you. So now, Karen has been guiding me and many other homeopaths and those who are new to homeopathy and want to learn about it in the healthcare field. And she provides inspiration, motivation, business acumen, obviously a lot about homeopathy and the different ways that people can be experts in the field. She herself is an expert, and the accomplishments she has done is just boggles the mind. She wants to provide integrative telehealth healthcare for the nation, for people who don't have access to a homeopath in their local area. So this is something she's working on. She's nationally certified in classical homeopathy, has been practicing since 1994, and for the past decade, her work has been primarily focused on endocrine, reproductive, and fertility issues. She offers biochemics, gemotherapy, counseling, hypnotherapy, botanical and nutritional supplements, and dietary therapies to her clients. She's not a physician and does not diagnose and treat specific diseases. This is something that we always say on Health In and Homeopathy World Community. If you need specific individualized care, please see your own healthcare provider. So we also have a caller. Yes. Caller, are you with us today?
Oh, yes. I was actually, I saw something online about that today you were having Karen Allen teach about overactive bladder syndrome and incontinence. Is that
She's here with us now.
Okay.
And I'm
Then
going to
I'll just
ask her to say hello. And then if you have a...
Let me find out.
Okay.
Caller, are you trying to just listen to the show?
Yeah, that I since I have you, I could just ask one question. But I was trying to listen to the show. Yeah.
To listen and watch the show, you need to go to nissancommunications.com
Yeah.
and click on the channels and go to the health end. So you will watch her and see her. The Skype link is for people to call in and ask questions.
Right. I understand.
Okay.
I
Just wanted to make sure, because there are
Okay.
people who
No,
try.
I have been having trouble getting it. So I do have your Nissan Communications, and it
Let's-
seems to be a show. She's talking about Qigong now from October 13th.
Okay, refresh.
Click. Are you in the health end?
Yeah.
Just refresh your page.
No, I don't know how to do that. I'm on that.
In your browser,
Yeah.
The URL bar. Just re-click it.
that'll do it? I
Yeah.
never knew that.
Yeah.
What do I do?
Go to your browser where the URL is, and then just go in there and re-click to the Nissan Communications /healthin.php. There is if you're on the Mac, there's a little
Wow.
turn signal. Okay, Karen, say hello to everybody. We're doing all of this
Hello.
introduction.
It's wonderful to be here. Thank you so much, Debbie, for inviting me to join you.
And I'm going to go ahead and open up my PowerPoint too. If you have any, special thing that you want to introduce with, or I wanted to tell people how to reach you also, and that's at KarenAllenHomeopathy.com, or any special message that you want to begin with today.
I certainly wanted to thank you for the opportunity to talk about this because it is such a common condition. And if we still have the caller on the line, I wanted to see if there was a specific question that he had.
Yeah, I saw you were going to talk about Kegel exercises, and I've read something recently, and I can't come up with the name of any of the authors, but people are stressing more other pelvic floor exercises, sort of beyond Kegel, and I wonder if you had anything to say about that, but maybe you'll get to that later.
Thank you. Yes, I will be talking about that a little bit, but I can say right up front that this is very much a growing field compared to, say, 8 to 10 years ago, where pelvic floor therapists that specialized in that area of the body hardly even existed. Now there's at least a handful of them, and there are various areas of physical therapy that can be done that can really help with the urinary issue. And in addition to just Kegels, I suggest that people, if this is a chronic problem for them, that they seek out a pelvic floor physical therapist and or seek out someone who is certified in Pilates. Because Pilates has a lot to do with, in Pilates, they call it the torsal canister. If you think of your torso like a can, and there's a top on the can, which is your diaphragm, and there's a bottom on the can, which is your pelvic floor. And your diaphragm moves up and down as you breathe, and your pelvic floor also moves. And all of the musculature of the torso has a big effect on the health of the pelvic floor. And so a lot of the exercises that are done in Pilates to create strength in the core actually also really are complementary to things like Kegels. Does that help with your question?
Great. That's great. Yeah, that's very helpful. Thank you very much.
Yeah. Okay.
And one more.
We will also actually talk just a little bit about Kegels. There are some conditions for which Kegels are contraindicated. And so we'll mention that later. They're not always a great idea. I don't know of any conditions for men where they are not indicated, but there are conditions of pelvic pain for women where they are contraindicated.
I'm going to be
Okay.
interested to find that out. Also, I have read that going on the rebounder very slowly and gradually is also a good way to support and build the musculature in that area.
Great. Thank you. That's
Okay.
great. Thank you so much for your help.
Oh, you bet.
And anybody else who wants to call in with questions, that's why we're here today. So I'm going to go to the front page of that handout that you provided.
Okay, so let's just talk about, where are we going with our conversation today? And we're going to talk a little bit about the whole issue of urinary urgency. If you're not a practitioner, or if you don't have the issue personally, or you don't have a family member with it, you may not be very familiar with how very, very common this is. And then we're going to talk about seeing the symptoms in the context of the health of the whole person, kind of what's happening in the forest and what's happening in the trees. And we'll talk about ways to think about that. And then we're going to talk just a little bit in the context of homeopathy, how we see this, what is the pattern of symptoms that's important. And then we're going to go through 3 very specific therapeutics that are widely used, and they can be very, very helpful to an awful lot of people who have these kinds of complaints. And we'll have a few example cases. And at any point, please, if you have questions, feel free to hop in, and we'll see if we can answer those questions along the way in our conversation. So first of all, let's just talk a tiny bit about what is overactive bladder syndrome. It's abbreviated as OBS in your doc's chart. And a bladder can usually hold about 2 cups of urine. And a normal, healthy person empties their bladder every 3 to 4 hours through the day. But for clients with an overactive bladder, they have a very frequent need to urinate. They actually feel the need to urinate 100% of the time. And they may end up actually going to the bathroom every half hour, which, you can imagine how disruptive that can be in your life if you're in a work position where that makes it difficult. A lot of times for people with overactive bladder syndrome, not only do they feel the need, but it comes on suddenly, and it is a very strong urging. And sometimes they just don't have a chance to make it to the bathroom before things start flowing, which can be definitely a problem. Lots of leaking, not so fun. So it happens mostly for gals, not so much for guys. Some, but not so much. In the U.S., we have about 33 million women who are people who are affected by overactive bladder syndrome, mostly women. And the older people get, the more likely it is to be an issue. So in the 40 to 44-year-old age range, it's about 8% of the population. By the time people are over 75, it's over 30% of the population. So there are a lot of reasons why this comes about. Some of them are just basic lifestyle issues. People who have anxiety issues are more likely to have overactive bladder syndrome. People who drink too much, a lot of excessive alcohol intake can create a lot of urinary problems. And some people, because they are anxious, because they have other things going on with habits, they just get into the habit of, like they might be restless. They go to the bathroom because they're restless. Or they wake up frequently in the night, and each time they wake up, they get up and go to the bathroom because they happen to be awake. So it's sort of a fallout of some other habitual pattern. As far as urinary factors, people who have chronic urinary tract infections are more likely to be going frequently. People who have overactive muscles, spasmic activity in the pelvic floor muscles, or people with stones in the bladder or prostate issues, all of those are more likely. And particularly for older men, the prostate issues are a huge factor in having to urinate frequently and having incomplete urination. And the gals don't exactly get off easy either. Pregnancy, bladder prolapse, fibroids, pelvic surgery, all the things that can either create weight or adhesions in the pelvic bowl are things that can cause urinary issues and be a factor in overactive bladder. And then there are some underlying medical conditions. You know, one of the most common indicators that show that diabetes is coming on is very frequent urination. And so for people who have diabetes, people who have a history of a stroke, any kind of spinal injury or trauma, and also lots of medications. You know, when people are given blood pressure medication, such as lisinopril, very often the blood pressure med comes along with an additional prescription for a diuretic such as Lasix. And these things can be factors in helping people have to urinate because they're trying to get rid of all of the fluid. And for people with medications where one of the side effects is frequent urination, that's not really an issue with their original health situation. It's really fallout of the medication they're taking. Nonetheless, they have the same symptoms. Okay, so how do we end up with overactive bladder symptoms? Exactly how do we get to this point? When there is excessive production of urine, then we end up just with more frequent urination. There's a lot of factors that can create a situation where the body is just making too much urine. So, as we mentioned before, diabetes, having high blood sugar, high blood glucose in general is going to increase the production of urine because your body's trying to reduce the blood sugar. Hypercalcemia, where you've got too much calcium. You know, basically your body's trying to do you a favor by getting rid of stuff. There's a thing called psychogenic polydipsia. This is where people who are nervous or anxious drink almost compulsively. They have to have a lot to drink all the time. And that just causes more water flowing through or whatever flowing through your body. And then, of course, the use of diuretics. So one side of the overactive bladder thing is just too much urine. The other side is a reduced capacity to hold it. So there are some people who they think of themselves as people with tiny bladders. You know, I did some service work last year in Haiti with Homeopaths Without Borders. And while I was there, one of the women that I worked with was like a camel. She got up in the morning and she urinated while we were there at the guest house, and then we would go out in the tent camps and we would be there all day, and she would drink water all day because it was hot, and she wouldn't have to urinate until we got back to the guest house again in the evening. And I definitely was not that gal. So I had the adventures of trying to find a private place to urinate there in the tent camps, and that was its own story. But for a lot of people, this ability to hold your urine for a very long time just doesn't exist, especially as you get older. So the reduced ability to hold urine is what triggers the need to urinate. And any kind of urinary infection, and you know, there are a lot of, if we look just at the concept of microflora, if you look at the average person standing in front of you, about 10% of what you're looking at is actually their original human cells of their body. And the other 90% of the body mass in front of you is actually all of the microflora that are part of humans. So all of the bacteria and microorganisms and viruses, all the things that live in your gut that help you break down things, all the things that live in your skin, some of which help, some of which are neutral, some of which are bothersome. All of those microflora things affect the urinary tract. And some of them aren't even enough of a bother that we would call them a pathogen. You know, like Streptococcus, which is very common in the urinary tract, or Staphylococcus. Some of them are just little bacteria that are hanging out there that are a little bit irritating. And the urinary tract doesn't like that. And so it's saying frequency. Let's get rid of this stuff.
We have a couple questions.
Okay.
Okay, Susanna is asking, does holding your urine all day weaken your bladder over time? And I kind of remember telling my kids, especially my daughter in elementary school, please ask to go to the bathroom and don't wait until you get home, thinking that might cause a urinary tract infection. So that would be one question to answer.
Okay, so I can tell you that holding your urine for a lengthy period of time after you have the urge to go, and, you know, sometimes you're in the car, you know, you can't just hop right to it. But to hold an excessive duration of time it predisposes the growth of bacteria in the urine inside the bladder. So in general, it's not a great strategy. If you have the choice to go, it's always a better option to go. Does that actually weaken the bladder mechanically? I don't believe so, but it does predispose to growth of bacteria, and that can cause a greater need for urging.
Okay. Also, my question has to do with the fact that we're told to drink 8-ounce glasses of water a day. Is that a good suggestion, and how does that contribute to this flow of water in the body and out?
I'm really glad that you brought that up because it's a really interesting question. If you search back to the origin of the 8 glasses of water a day, it was someone's opinion. Mm-hmm. And there is absolutely no scientific rigor behind that. Now, for an awful lot of people, yes, it is a good idea. Having enough fluid that we flush through is a very good idea. But there are some people where their need for water, just because of their physiology, is going to be much less than others. And I do not believe that you can say for every single person, 8 glasses of water is a good idea. That's about 2 quarts of water per day, or 2 liters.
Especially when we think in homeopathic speak about pulsatilla natured people who have no desire to drink, they're not thirsty, then they could go all day and not drink a sip, which is not a problem for them, I would assume.
Right. And one of the ways that you can check is by evaluating your urine. Your urine should have, for a healthy person, your urine should have a pale yellow color, and it should not have a strong odor. If it has a dark yellow color, or it has a strong odor, or it creates a foamy surface on the water in the toilet after you urinate, then that shows that there's too much concentration. The foaminess comes from too much phosphorus in the urine. The darker color comes from too much content. And the stronger odor, again, because it's too concentrated. So if that's what you're seeing, then you should probably be drinking more water. If, on the other hand, you're seeing absolutely clear fluid with no odor at all and no color in your urine and no foam, nothing, then you probably could back off on the amount of water that you're drinking without anything negative happening.
Thank you very much. Okay. So for those folks who just tuned in and got onto the chat, we do have a PowerPoint along with this program today. If you go to homeopathyworldcommunity.com, click on the banner, and there is a link there. Also, I am posting notes in the chat, and if there's anybody who wants to ask a question or make a comment, I am watching on the chat and will relay that to Karen. Okay.
Thank you. Okay, so we talked about how do we end up in the overactive bladder realm, and one of them is just producing too much urine. The other one is a reduced ability to hold it, and we talked about infection as a factor there. And one of the other things is just reduced space in the bladder. So imagine a gal in her 40s or 50s who has a large fibroid that is in the front part of the uterus. either inside it or outside it, and it is weighing down and pressing on the bladder. And that may, because based on where exactly it's compressing the bladder, it may make it hard for the bladder to empty completely, or it may make it hard for, there just isn't very much space for the bladder to fill to its full capacity. And the same thing with prostate issues. There's just a frequency that's because of the mechanical space proportions.
And so homeopathically, I think we just lost sound.
Oh,
there you are. Okay.
Okay.
Mechanically, can homeopathy help with these issues?
Absolutely.
Okay.
Before we start looking at what can homeopathy do, it also helps us to step just a little bit into some of the theory and philosophy behind homeopathy to look at how do we frame the symptoms we're seeing. And one of the important questions that homeopaths ask themselves as they're evaluating a client's situation is this symptom actually something that is inherent for the situation of the person? Is it a symptom of the expression of the vital force? Or is it a symptom that is arising from some other cause? For example, if I recently have been prescribed lisinopril because of my blood pressure and Lasix, and now I have very frequent urination, and I go to my homeopath and I say, wow, I am in the bathroom all the time. I didn't used to be like this. And I forget that this has only been happening since I started taking these medications, because in my mind, those two things are not connected at all. If the homeopath doesn't ask, have you started taking any new medications since the last consult? I won't remember. I won't mention it. The homeopath won't know. And then this might be treated as if it were actually part of my own body's symptoms being generated instead of the result of a medication. So this is very important. And if you're a client, making sure that you let your practitioner know, oh, I started this medication since the last time we talked. Really, really good idea. So homeopathy was originated by a German physician named Samuel Hahnemann. And Hahnemann taught us about what he called maintaining causes and obstacles to cure. And these were basic things within the person's life and lifestyle and function that caused problems that could be corrected by their own resolution. So one of the things that he says in a textbook that we have as homeopaths called The Organon of Medicine, he says the age of the patient, his mode of living and diet must be taken into consideration in order to ascertain whether these things have tended to increase his malady, his illness, or in how far they may favor or hinder the treatment of it. So, as an example, we know that urinary tract infections tend to be more frequent in women who wear underwear that does not have a cotton layer right next to the pelvic floor, and especially for women who wear thong underwear. Those urinary tract infections are more frequent because of the mechanical process of that kind of underwear. That's not something that a homeopathic remedy can cure, but it's something that when the client is educated about it and you say, hey, the part of the problem, could you please make sure that your undies have a cotton layer and no more thongs? If this is an issue for you, this is telling you that this is not good for you and you need to change what you're doing. These are the kinds of things that are maintaining causes and obstacles to cure. And there's a lot of urinary tract stuff that happens in this category. So he goes on to say, hence the careful investigation into such obstacles to cure is so much more necessary for clients who have chronic diseases, as their diseases are usually aggravated by these kinds of difficult influences. and other disease-causing errors in the diet and regimen, which often pass unnoticed. So this is one of the things where anybody who has these kinds of overactive bladder symptoms can ask themselves, what am I doing about excessive alcohol intake? What am I doing about the kind of clothing? What am I doing about sexual partners? And for women who have intimacy with somebody, they need to urinate before and after. All of these are basic kinds of things where you want to make sure that you're taking care of whatever you can on your end before you start looking for a medicine to intervene. Now, he says that the most appropriate regimen during the employment of any kind of medicine in chronic disease consists of the removal of these obstacles to recovery. So we need to talk with ourselves and with our clients and with our family members about what medications are you taking. Do any of those things have frequent urination as an issue? If so, can the person talk to their prescribing physician and say, are there other options that I could pursue here? Because this one is causing a problem for me. Or they can look at their supplements that they're taking, at their alcohol consumption, at the basic mechanical issues that we mentioned, at exercise, at diet. So I always encourage people to talk with their prescribing physician if there's any kind of factor that has to do with a medication, and also to look at what can they do themselves to make themselves healthier. There's one other theoretical principle that I really want to get. There is within homeopathy a difference between disturbance of sensation and function and where people actually have organic tissue change. So, as an example, disturbance of sensation and function is irritation and frequent urination and burning during urination. Those are all things that a person feels that have to do with what are they sensing and how are things working. But there may not be any kind of actual mechanical change in the body. The other side of that is when there's actually organic tissue change. This is where there's a big fibroid sitting on the bladder, or where the prostate is much enlarged, or where there are stones in the bladder or in the ureters. These are things where there's actual physical change. And again, when the disruption is on the level of sensation and function, it is much easier to resolve the complaint by sorting out what's happening in the lifestyle and regimen of the person. Once you move into actual physical tissue change, then you're more likely to need specific kinds of therapeutics that we can use in homeopathy and other integrative modalities to correct those. Okay, so Debbie, are there any more questions at this point, or should we carry on?
Let's keep going. Yeah, we have a lot to cover. Great.
Okay. So the next thing, who's actually presenting with these urinary issues? It's both genders, all ages, and the more you age, the more likely you are to have these issues. If you have high blood pressure or diabetes, then you're much more likely to end up with overactive bladder syndrome. You're also more likely if you happen to be Indian, Asian, or Black. Those racial predispositions show up in the statistics. And if within homeopathy, there are predispositions to particular patterns of disease, and there's one of these called psychosis, which is if you have this pattern in your family history, then you're more likely to end up with urinary issues. Postpartum gals, it's an issue for a lot of gals after having a baby, and also for gals with a new sexual partner. You know, maybe somebody's broken up out of a long-standing marriage and now they're dating again. They fall in love and they have a new partner. And after they get together with their new partner, they begin to have urinary issues they've never had. This is one where there's likely to be microflora that aren't playing so well in the communal sandbox. and needs some help to sort out.
We do have a question.
Okay.
I think the person, it's Mimi, and she's asking, I think it's between an acute situation where these sensations are there or a chronic, longer term concern having these sensations. And I don't know whether she's talking about having any pathological changes at this point, but so she says, do we need a constitutional remedy?
Oh, that's a great question. So you can have disturbance of sensation and function that is very long-term and chronic. As an example, neuralgic pain, where there's no physical tissue change, but there is overstimulation of the nerves. And that can happen either in an acute context or a chronic context. Organic tissue change generally happens in chronic context. But there are times, for example, let's say somebody their hand with a knife while they're cooking. And there you've definitely got organic tissue change going on in an acute context. So either of them can happen either way. In general, organic tissue change is part of the chronic picture. And then you ask a very good question. Can a constitutional remedy resolve this? Yes. To the extent that the constitutional remedy has an affinity to the urinary tract, it can relieve all of these symptoms. Sometimes it doesn't. Sometimes it helps many other things for the person, but it doesn't resolve the urinary issues because the remedy doesn't have a strong affinity. And then there are other approaches that can be used.
Okay, more
Does that answer the question?
Yeah, more questions. Mimi is asking about her mom with an age-related issue, and she's had this for a number of years. That's one question.
There's a urinary issue that's been happening for a number of years.
I would say she must be asking about this incontinence. She did not be specific about whether it was she was having the sensations or frequency or losing the urine and not able to get to the bathroom. I'm not specific, but it's age related, obviously.
Okay. So we will be talking about that in the next few discussion points. So I'd like to hold that question. We are talking today about specific therapeutics that can be used for that.
Okay. She was talking about the leaky bladder and frequency, and this is really, really common. If it's your mom, and like I'm a grandma, over time we have had given birth many, many times. We are losing the muscular structure there, and unless she has done all the things that we've talked about preceding this point in the show of exercise, really special care to that area, intentionally diet, going frequently to empty the bladder and all of these other things, that would be where you would start. So we're going to keep going on with the information now.
Okay, so in a study in 2002, there was a survey that was done in Europe, and the only question they asked was, for women, have you experienced any symptoms of urinary incontinence in the last 30 days? And 32% of women who responded from the UK said yes. 34% of German women said yes. 32% of French women said yes. And 15% of Spanish women said yes. Makes me wonder what's going on in Spain. But if you look at this, this means that if you're standing in a movie theater waiting room, a third of the women there have had some kind of symptom of this in the last 30 days. So this is a very, very prevalent issue. In terms of male to female ratio, the men have much, much fewer symptoms until they get into the 65 and up range. And then they get up there with as much as the women. But prior to that, it's really an issue mostly for the gals. And we see very, very little of this prior to age 40. So it's really an issue that we see in women who are in their 40s, 50s, 60s. So what happens in the medical world for this? There are medications such as Toviaz and Enablex and Vesicare, Sanctura. Many of these are medications that interfere with the body's water balance on your behalf to try to reduce the overproduction of urine, thus making it less likely that you have to urinate all the time. The main side effects are that they dry you out. So people complain of a very dry mouth and constipation, and there are some allergic reactions. There's also a surgical intervention that is done where they actually do bladder augmentation to increase the size, which is a fairly extreme resolution. And within progressive and integrative modalities, there's physical therapy, pelvic floor physical therapy, and you can go Google pelvic floor physical therapy. It's an actual subset of work. And again, Pilates, where they're actually looking to improve the musculature. So within homeopathy, what do we have to offer? We can help with both the sensation and function issues and the physical tissue changes. So we can improve that urging sensation, making it less frequent. And in cases with tissue change, for example, let's say it was someone who had endometriosis and they had laparoscopic surgery, which left scar tissue in the abdomen, and there are adhesions around the bladder that don't allow it to fill up completely. We have options, homeopathic options, that can break down the scar tissue. And we can also use homeopathy to relieve some of the predisposing factors like the high blood pressure, the subacute infection, the blood sugar dysregulation, the hypercalcemia, the fibroids, all those things that land you in the world of overactive bladder. And one other thing that I wanted to say, anyone who has urinary symptoms can use a dose of encouragement and support. There may be a lot of feelings of shame or despair about this. Gosh, I'm only in my 50s and I'm leaking urine all the time and I have to wear a pad all the time. And heck, what's life going to be like when I'm 70? And they can be very, very embarrassed about this. So we want to connect people with resources to help them see what are their options and to see it's not them. There are a couple of great websites, www.NAFC, the National Association for Continence. So, and some of these are in the handout. So please consider, if this is an issue for you, reaching out to some of those organizations and getting some additional resources. And then one last, go ahead.
I just wanted to let you know we have about 15 minutes left.
Mm-hmm.
Okay.
Thank you. The World Health Organization actually says that incontinence is a largely preventable and treatable condition, and it is certainly not an inevitable consequence of aging. So I really encourage people, do whatever you can for yourself and find solutions. You know, go to see a homeopath, go to see an acupuncturist. Do what you can. Don't just accept, oh, this is the way that it is. So I also wanted to introduce one other idea, which has to do with the way that uric acid is managed through the body. And the predisposition to have something wrong with the urinary tract is a pattern within homeopathy that's called the uric acid diathesis. And this is the predisposition to have pH balance issues and the buildup of kidney stones and things like that in the body. When this predisposition is present, you're going to end up with symptoms like chronic urinary infections, stones in the kidney or urine or bladder, gout, where there's inflammation in the joints because of uric acid buildup, chronic kidney pain, chronic asthma and bronchitis. You know, the kidneys control the water balance in the lower half of the body, and the lungs control the water balance in the upper half of the body. So when the kidneys aren't acting so well, you'll often see disruption also in the lungs. nerve irritation, urinary issues with chronic vaginitis, osteoporosis, and calcium management issues, because the kidneys either suck back in calcium that's floating around or they excrete it. So all of these are things that are likely to be an issue. So let's look at a couple of cases. As a first case, let's just take the example of a 57-year-old woman who has urinary incontinence. And she says she has a history of kidney stones, and her biggest problem is that she always has to pee. Even if she just went to the bathroom 15 minutes ago, she'll need it again. And it's been getting worse over the past 5 years since she got into menopause. She also has bone spurs on her ankle and on her shoulder that have been removed by surgery twice, and they come back. She doesn't sleep well because she has to get up frequently at night to urinate at least once an hour. And she's been on several different medications, and they have a lot of side effects that she doesn't like. So this case shows a lot of the kinds of things that we were just talking about, the calcium dysregulation, the stones that have been happening, the urination. And one homeopathic remedies that can act very well in a case like this is called Ocimum canum. And Debbie, maybe you can type that name into the chat. This is actually the herb holy basil. And in actual active kidney stone pain, it's very useful for resolving pain, but it's also great when there's uric acid disruption. You can get this remedy in a low potency like 3X or 3C and take it once a day, and it strengthens the urinary tract. Now, and it reduces the size of kidney stones. It resolves subacute infection. And like any homeopathic remedy, you don't want to just start taking something and take it forever. But you might want to take it for 3 weeks, evaluate the response, and then maybe switch to something like a cell salt that also strengthens the urinary tract, like natrum sulfuricum in a 6X potency, where you take that a couple of times daily for 3 weeks. And then you might switch to something like a gemotherapy tincture like silver birch. And Debbie, if you wanted to put in Dr. Stuart Garber's website, he has some great combinations of gemotherapy that strengthen the urinary tract that some of the viewers might be interested in.
Okay. Do I have that? Stuart Garber?
Yeah.
Okay.
If somebody just searches Stuart Garber, Gemo,
okay,
they'll be able to find his website, and he has some nice options. Okay, so another case example is a woman who has terrible urinary tract infections. She's a 19-year-old gal, and she's had horrible infections for the last 3 years. And every time she feels like she needs to urinate all the time, and she gets this terrible cramping spasm at the end of urination that's really painful. And usually she goes in to see her doc, and she's given antibiotics, and the infection goes away. But for weeks after that, when she sits down, she'll leak a little bit of urine, just enough that she always has to wear a panty liner. And she's had one urinary tract infection every month for the last 2 years. So again, here the issue is subacute chronic infection. And this has been going on for years. And a great homeopathic for this is sarsaparilla. It is made from the herb smilax, and in my practice, this is the most helpful overactive bladder urinary support when subacute infection is the likeliest factor. So you can take this remedy in a 6X potency, morning and evening each day for 3 or 4 weeks, and then reevaluate. And these are things that are safe for people to do if they want to order these remedies from homeopathy overnight and just try them themselves and see because these are nutritive herbs, the Ocimum canum and the sarsaparilla in these low potencies. And then reevaluate after a few weeks on the remedy. How am I doing with the frequency and the urging and the infection? And if you have questions, contact a local homeopath and see if they can direct you further. But these are great things that are safe for you to do at home. A third case is of a client who had a really bad kidney infection. And he was a triathlete. He was a 36-year-old guy coming in, and he had gone on this triathlon, and he had gotten very badly dehydrated. He said they were competing in very high heat and very high altitude. And he said, I just couldn't drink enough to stay hydrated. So he passed out after he finished the last leg of the competition, and he woke up in the hospital on IV fluids. And ever since then, he's had a problem with urinary incontinence. With any kind of physical stress, like coughing or sneezing or jumping, he loses a little bit of urine, and he always feels like he needs to urinate. And he says, there have been a few times when I've woken up and I've found that I've actually lost urine in the bed. And he said, God, this is just mortifying.
Yeah, that's our sound effect, Guy.
Okay.
It is mortifying to wake up with it, and you've leaked it overnight and you didn't even know it.
He said, "How am I ever going to have a girlfriend?"
Yeah,
and this is just like so not cool. So
I can't go over and have a sleepover date.
Exactly. So he said he had tried medications and acupuncture and yoga and biofeedback, and none of those things had helped. And the remedy that actually helped him was one called Serum Anguilla. And it's a homeopathic remedy that is used when there's deterioration of the kidneys. And this medicine was actually used in a clinical trial in India where they were able to help clients, people who were on dialysis, reduce their frequency of dialysis, and some of them were actually able to stop it. So when there was damage to the kidneys, such as in this client's case where he got severely dehydrated, this is one of the strongest options. And you can buy this remedy in something like a 12X or a 9C. This is a remedy that in its natural form is a poison, and so you don't want to take it in a low potency like those nutritive herbs that we talked about. These are things that you would take in like a 12X or a 9C. And you take it once, twice, 3 times daily, depending on your circumstance, for 2 to 3 weeks, and evaluate your symptoms, and then consider a switch to an appropriate cell salt like natrum sulfuricum. So,
natrum sulfuricum seems to be coming in quite a bit.
Yeah, it has a great affinity for the urinary tract. So then what are the other things that anybody can do for themselves if they're trying to tackle this issue? The first one is looking at what are my medications, adjusting dosage, adjusting what medication you're taking, working with the prescribing physician to reduce the symptoms. Another one is sometimes people are taking diuretic herbs without realizing them. People who drink a lot of dandelion or chicory or fennel or mint tea. Those can be an issue.
Really?
Yeah.
I thought it would be good. I mean, like eating asparagus, making a lot of parsley, pesto. I thought that's good for helping to clean out the urinary tract.
The urinary tract, yes. And if you have infections, it's good.
Okay.
But if you are one of those folks who just has too much urine going on, it's not so good.
Oh.
So you have to look at what's the actual situation. Another one is looking at fluid intake, specifically how much caffeine and how much alcohol. So if you're one of those people who drinks 8 or 9 big cups of coffee every day, you got to look at what's doing with your urinary tract.
Mm-hmm.
And then reducing the contributing factors for a urinary tract infection. Good hygiene around sexual activity. Gals need to urinate before and after every single time. It doesn't matter how comfy, cozy, cuddly you are in the bed. You got to get up and go and urinate because things get up in your waterworks and you got to get them cleaned out of there before they have a chance to cause problems. And looking at your underwear choices, looking at dietary choices. When you're eating a lot of sugar and your blood sugar's dysregulated, you're going to be predisposed. And one other thing that can help a lot of gals if they're having a urinary tract infection is D-mannose. D-mannose is a sugar that actually lines the inner surface of the bladder so that you don't end up with a place where bacteria can find its way in and colonize there. So read on the internet about dosage, good dosage for D-mannose, and if you have it on hand, if this is something that's a chronic issue for you. One of the other things that you can do that's helpful is scheduled voiding, where you say, okay, I'm going to urinate at the same time, and you start with every half hour, and then can I do every 45 minutes? And you kind of train your bladder to reduce your reactivity to urging. And then pelvic floor exercises. Kegels are great. When urinary incontinence is associated with pain, Kegels are not indicated because the muscles are too tight and you don't want to be contracting them. So anyone who has urinary incontinence associated with pain, do not use Kegels. Everyone else, get out there and Kegel. I recommend that anybody do their Kegel exercises every time they're at a red light in a car. Nobody around you will know. It's okay. Do them because that's something that you end up with happen frequently. So every time you're at a red light, do those muscle contractions. And both men and women can benefit. Okay, so that's it. That's all of the information. Do you have additional questions for us, Debbie?
Everybody's been quiet because I think this was the part that they wanted to be tuned into and know about these remedies. You mentioned remedies that people don't typically associate with this problem. I mean, benzoic acid, I think about. Let me see. I had posted some things onto Twitter and onto the Facebook page about remedies that are typically associated with these problems, like maybe causticum.
Right. A lot of those remedies are great with active urinary tract infections where, the symptoms are severe. Some of those don't really do so much in terms of overactive bladder syndrome, where you're really talking about a chronic condition of irritation. And again, sometimes this is going to be resolved by the constitutional remedy. Sometimes you'll have a situation where the symptom is very clear, the pattern is very clear in a urinary tract infection, and the remedy you give just actually resolves the problem. But sometimes it actually is just a chronic weakness of the urinary tract. And in that case, these three remedies are your friends.
Marvelous.
So if you had a situation where you took a constitutional remedy that helped in every other way, but it didn't fix this, or you took a remedy for a urinary tract infection that resolved the acute infection but left this weakness hanging and didn't resolve it, or you took it time and it didn't work as well, those are all situations where you would want to look at these options.
Like that athlete that had the dehydration. So each condition, each situation is unique and must be looked at in that way. That is what we as homeopaths understand, that we must use our listening skills to hear what is the history, the story, and take all that information in about the medications to see that there's might be something out there in the person's life that is contributing to the problem. We think about Staphylococcus aureus, think about anger, think about honeymoon incontinence. We think about all of these different things as homeopaths. And again, let me give out your website for folks who are interested in your stellars, your classes, your innovations with telehealth, and your other speaking engagements.
Sure. The website is www.KarenAllenHomeopathy.com. And there's information there on all kinds of therapeutics classes, many of which are focused on women's health, and other places where I'm teaching. And for any of you who are listening to this, if you happen to see me at the National Center for Homeopathy Conference, I'll be speaking next April. Please come up and introduce yourself and let me know that you were on the homeopathy community.
Wonderful.
And thanks again to Debbie for the opportunity to come and teach and for all the work that you do to weave the fabric of the homeopathic community.
Yes, we like to shine a light on all of those who are doing beautiful work. Next week, November 11th, for Veterans Day, Renita Herman, also from California, will be talking about the gentle homeopathic approach needed to address veteran issues. And she has been on in the past and is marvelous. November 18th, we have Maria Boll talking about homeopathy, an emerging profession. And we will have a special Blog Talk Radio November 19th, which would be a Tuesday, with Christina Munns. Thursday, Blog Talk Radio, always at 1 p.m. with Alan Phillips, vaccines and your rights in the United States, about exemptions, waivers, and everything that's happening in the vaccination arena today. I want to thank Amnon so very much for taking care of the dashboard over here. Upcoming next in about an hour, 1 o'clock, is Marilyn Shannon, Breaking Free Show. And I'm not recalling, I think she's having a veteran on today. Yeah. She's going to be talking about that. And please contact us. Give some feedback. Do you enjoy these shows? You have ideas for new shows. And a little bit of sunshine. I want to thank a sponsor. Down there's a coupon for 10% off of these incredible lights that are bright white, full spectrum lights. They really shine up your dark winter and autumn days. Good for seasonal affective disorder. And check out Complete Dynamics program for homeopathy. It is a great way to study the materia medica, the different remedies, and to do a quick analysis. So those are the things that I have to share with you today. And we will see you Thursday on Blog Talk Radio and next Monday back here at 11 a.m. Happy Diwali to all of those who are celebrating. Bye-bye.
Bye.
You are tuned to the Nissan Communications Network. Our weekly lineup of call-in programs includes Computers 2K Now with Amnon Nissan, Sundays, 9 a.m. till noon. Carrie's Psychic Cafe with Carrie Silkowski, Sundays, 8 till 9 p.m. Health In with Debbie Bruck, Mondays, 11 a.m. till noon. Breaking Free with Marilyn Shannon, Mondays, 1 till 2 p.m. Lessons of Vietnam with NCVVI members, the second and fourth Wednesday of each month from 7:30 till 8:30 p.m. Reawaken Your Brilliance with Julie Seibert, Wednesdays, 9 till 10 p.m. And if you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it at www.nissancommunications.com. Sponsored by ThatVidBlasterGuy.com, CarolinaApparel.com, and DeltaForce.net.